Later today, the Prime Minister Sir Keir Starmer, the Health Secretary Wes Streeting are going to set out the government's 10-year plan for the National Health Service, shifting care for patients out of hospitals, aiming to cut waiting times, to prevent, to have more digital services.
And Wes Streeting, the Health Secretary, joins us now. Good to see you this morning. I know this is something you and the Prime Minister have been working on and promising for a long time, the 10-year plan and vision for the NHS for the future. We've got a few details so far, haven't we? More care to the community, using dental staff to do other things, and also AI. Broadly speaking, the plan is getting a great welcome. The challenge is the delivery. That's what people really want to know about. And of course, that involves money.
It certainly does, and that's why the decisions taken by the Chancellor to give us the investment that we need, an extra £29 billion to invest and reform our National Health Service, because the tragedy of the NHS that we see today is that we're paying more and more for a poorer service. People are not getting the right care in the right place at the right time. That's worse for them in terms of their experience as patients. It's also more expensive for the taxpayer. So reinventing the NHS as a neighbourhood health service as much as a national health service, care closer to where you live in new neighbourhood health centres, care indeed in your home, will be better for the patient and a more efficient use of taxpayers' money. And that's vital if we're to protecting this century the principles that underpinned the NHS for the last century, which is whoever you are, whatever your background, healthcare will be available to all based on need and not the ability to pay. That's the principle we're defending, but in order to be able to deliver it in this century, for the NHS to survive and thrive, we need the investment and reform needed to deliver the results.
Clear principle. I hate to say a but I've got to come back to the delivery. Putting things into community, that costs money, there's a structure, where are they going to be? It's all those questions, isn't it?
Yeah, and look, partly people can start judging us on results now we're a year in. So we promised 2 million more appointments to cut NHS waiting lists in our first year. We've more than doubled that. I said within weeks of taking office we'd employ 1,000 more GPs onto the front line because they were unemployed at the same time people couldn't get jobs. We've almost doubled that, 1,900 more. Waiting lists at the lowest level in 2 years. Now, I could go on, and I also know there'll be a lot of people watching who are saying, but I still can't get a GP appointment or I'm still waiting. We definitely know that. There's so much more to do. But I hope people start to feel a sense of quiet confidence and optimism that when we say we're going to do something, we follow through with it. And with the neighbourhood health centres, we're going to roll them out over the course of this plan. We're going to start with areas of highest need, and also those areas, particularly in towns and villages, in rural and coastal communities that are further away from the hospital, where that kind of one-stop shop service, all under one roof, your GP, sure, but also your dentist, your pharmacists, your blood tests and diagnostic tests and scans, your urgent treatment centres, all under one roof. That will make a real difference to people, underpinned by the investment we've set out in the spending review, the public investment set out, also looking at alternative investment to get in, and a combination of new centres where they're needed, brand new centres like the one that I'm standing in Stratford, but also where we've got poorly used estate, an estate that needs refurbishment, also refurbishing some of the existing and underused estate in the public sector. So we're making really good and efficient use of our resources and your taxes, because that's the challenge I feel on my shoulders. It's about delivering better care for patients and also treating your taxes with respect and getting more value for the taxes that you're putting into our National Health Service.
Well, Streeting, I'm not going to pour cold water on the vision. We had a lot of people today saying that it's exciting, but I am going to ask you difficult questions about what you said about resources and money, because the reality is you're talking about new centres away from hospitals. The figures say there's a maintenance backlog of 14 billion in the health service at the moment. It's doubled in the last 10 years. And in this spending review, there is no increase at all in capital spending in the NHS. You said you need more staff to get waiting times down and to do things differently. But at the moment, the the settlement for the Chancellor until 2029 is health spending rising by 2.8%. That is less than the average of 3.7% since 1948. It is more than half the amount that was put in place by Gordon Brown and Tony Blair when you saw the big improvement in the health service in the 2000s. In the last year, almost all of the money you put into the NHS has gone on pay for existing doctors, nurses and staff. So the reality is the vision is exciting, but the resources are not there to deliver this vision, certainly in the next 3 or 4 years, certainly not before the next election. This was not a settlement for the NHS, which really financially underpins his 10-year vision.
So I'm not going to dispute your historic facts, Ed, because all of the facts that you stated are absolutely accurate, but I will address the fair questions that you put. I mean, firstly, we've got the biggest capital allocation the NHS has had, but you're right, against that backdrop of the massive underinvestment in NHS capital, in bricks and mortar, but also the kit and technology that we need. It's one of the big drivers of poor productivity and poor value for money in the NHS. So alongside the public investment, we're also going to try and secure, as the government's infrastructure plan set out the other week, the private investment needed to, learning the mistakes of PFI, but looking at successful models of private investment, including the mutual investment model in Wales and other European countries where we've seen this work effectively to deal with that under-capitalisation, that under-investment in both bricks and mortar, the state of the estate, and also the kit that we need. It also, in terms of those numbers that you set out, this is why I'm driving so hard at reform. It's why I committed to abolish NHS England and reduce some of the back office admin costs in the NHS so I can put hundreds of millions more into the front line. And with the technology investment that the Chancellor has committed to and ring-fenced, that won't just deliver more ease and convenience for patients in terms of how we interact with the NHS. Crucially, it's going to generate the productivity gains that we need. For example, with this new ambient AI technology, so this is AI that listens to patient interaction with their doctors, it can simultaneously write up the notes, write the referral letters and do loads of the admin that the doctor would have had to do themselves. And just to give a bit of context on this, if we save just 90 seconds for every GP interaction with their patient, that would be the equivalent of creating an extra 2,000 GPs worth of time. And that's why I always emphasise that investment matters, of course, but so does the reform. And I wish that we had an economy in the state that it was when Labour came to power in 1997 and those early years of Labour government, not to mention the 13 years of success, growth and impact that we delivered. The economy is not there today. We've got the fastest growing economy in the G7, but you know as well as I do, there's more to do. So we've got to live within our means, and that's why the choices we've made are both for investment and reform to deliver results. But the plan we're publishing today is built on that credibility, a credible plan for reform and a credible approach to the public finances, and people will begin to see and feel the results over the course of this Parliament.
You're spelling out your vision, you're spelling out your image of the NHS for the future, but you will know this morning that in many of our viewers' minds and in our minds, there's another image that's front and centre, that of the Chancellor with tears rolling down her face at PMQs yesterday. Immediately, people thought this was about something to do with her losing her job, particularly when the Prime Minister didn't come back and specifically answer whether she kept her job. We now know it was a personal matter. Have you spoken to her? How is she? Because it felt like an image of a Chancellor crumbling that you wanted to reach out to.
I have been in touch with Rachel since yesterday, and she's a friend as well as a colleague. She will bounce back. And there are lots of people watching this morning who will have gone through those times where something's going on in your life, and when you go off to work, you can't just leave those troubles and those worries at the door. And we're all human. I think what makes us different when you're in public life, and especially a high-profile job like the Chancellor's, you're not just at work, you're often on show. And that was one of those situations yesterday. But people, I hope, have got the measure of Rachel as Chancellor in the last year. She is someone who, thanks to the choices she's made, and actually some of the times where she's had to say no as well as yes, that she's got the conditions where interest rates have fallen 4 times, where wages are finally rising faster than living costs, and where we've got the fastest growing economy in the G7. So just to reassure people, she's here to stay.
The problem is Wes Streeting, and, you know, putting aside the personal event which she was upset about, which we don't know about, huge sympathy for her. The reality is it's been a torrid week for the government. A week ago you were saying this welfare reform was essential, and then it's essentially almost entirely been ditched in the face of a rebellion. You said last weekend there were lessons which had to be learned. The government has to do better in the future. The winter allowance was a mistake. The decision at the time of the spring statement to try to remove personal dependence payments and raise £5 billion was a mistake. And those are mistakes which have done a lot of damage to the government's credibility. What lessons were in your mind when you said your government's got to do things better in the future than it's done in the past?
Well, on welfare reform, Ed, the fundamental problem there is that we didn't take people with us. We were going so fast that we didn't take people with us. And I think actually there is widespread consensus about the need to reform the welfare system so it's there for people when they need it, that when people can work, they should work, and they need support to get back to work. But fundamentally, we've got to make the system sustainable for the long term as well. Because we carry on as we are, by the end of the decade, you're going to see welfare spending at £100 billion a year, roughly half what we spend on the entire national health service.
Why didn't you take people with you?
And more than we spend on national defence.
Why didn't you take people with you?
I think there was. I think in terms of the pace of the change that people were driving at, I think that was where we didn't carry people with us. And the different approach we're now taking, thanks to the engagement between Labour ministers and Labour MPs, will be one of working with disabled people and a range of disability and health organisations, working with our colleagues in Parliament to deliver on the principles that we all agree are necessary. And I think the fundamental fear is no one wants to be sat at an advice surgery in their constituency on a Friday afternoon. Someone comes in, shows them their letters from the DWP.
Of course, the fear of the disabled people was that you didn't talk to them first. We know you've got a busy day. You've got to run. You've got a 10-year plan.
And we get that. We've taken that on the chin.
You've taken that on board. You've got a 10-year plan to launch. Will we see the Chancellor there? Will we see her today? Will we see her smiling?
You will see her out and about. She is going to be bouncing back. And I just say to people, the plan that we're launching today wouldn't be possible without the decisions and the leadership of the Chancellor. And she's here to stay. And thank goodness she is, because she's going to build a stronger economy, better conditions for businesses and improvements to the finances of every family across the land.
And fill a £5 billion black hole this autumn because of the welfare reforms having been dropped. Thank you very much indeed, Wes Streeting.